This one-on-one looks at a post 9/11 veteran currently at 40% with a weird situation for mental health evidence. We will look at increases, secondaries, denials, and new conditions, including presumptive conditions. I've started doing these one-on-ones so veterans can see how a claims coach would approach your situation, except I do it for free. My hope is to enable you to do this for yourself instead of paying someone else thousands of dollars. The best way to support is honestly watching the entire meeting, and I hope you're able to grab some gold nuggets from this. All right, so jumping straight into this and just kind of confirm that all this is correct. You were in from 16 to 20. You have a deployment from Jordan. Is that right?
Yes, that's right.
And then your disabilities, we're looking at cervical. That's going to be neck pain or upper back, left ankle, both knees, and then a jaw condition. Does that sound good?
Yep, that's right.
And then you're denied mental health, anxiety and depression, and then you're also denied back and constant pain. Do you know if that was for lower back?
No, this would have been, well, so I was approved for the back, but it's definitely worse than it was at the time. So it's definitely worse now, I guess, is what I was in that aspect. So I don't think it was lower. It should be upper back.
Okay. We're definitely going to look at increases here in a second. And then looking at your notes, I saw a lot of hearing treatment from your records, some muscle spasms. That's probably where the thoracolumbar. Thoracolumbar is just mid and lower back.
Okay.
I put that down as a denial because you're already connected for your upper back or your neck.
Okay.
We'll just say that blanketly.
Gotcha.
So that's probably mid to lower. I did see physical therapy in your records. Do you know what that was for?
Yeah, that was for my back.
Okay, that was for your back. Was that your neck area of your back or your entire back?
Mostly upper back and neck. Yeah.
Okay. All right. Cool beans. If I can spell, there we go. We saw some hemorrhoids, which absolutely sucks. Is there a current diagnosis of that?
No, nothing since I've been out.
Okay.
So the diagnosis came while I was in.
Okay. We're still going to submit the claim. It's probably going to come back 0% if at all.
Okay.
But I'm not really, don't sweat it too hard.
Okay.
Now looking at your medications for muscle spasms, I assume this was for your neck area too. I just want to make sure. All right, cool. That was for cervical too. And then you have a recent diagnosis of ADHD.
So yeah,
so
on that, I got assessed for ADHD. They were unable to diagnose me with ADHD based on a few different things, but in that report, I was diagnosed with a few other things. So severe depression, I think panic disorder. Let me open that up real quick. It was on the bottom. I can.
When was that? When was this exam get given?
1 second. But basically, the results of it were that I didn't have ADHD, but I had all these other things that were causing the attentive issues.
Oh, okay. I see.
Yeah, so I think all the way at the bottom, diagnoses: major depressive disorder, recurrent moderate generalized anxiety disorder, and unspecified sleep disorder.
Anxiety, depression, sleep. Okay. And that was from 22?
That was from
right?
22.
2022?
Yes.
Okay. Now, ideally, we'll just jump straight into denials. We'll look at increases here in a second, but we're already on the anxiety depression piece. So it's hard for me to make a recommendation without looking at your decision letter for that.
Right.
And I know we don't have that right now, but after this, If you go on va.gov, don't do it right now. It'll take too long.
Okay.
But go on va.gov, get your decision letter.
Okay.
For that, you go into your claim tracker, you'll find your letters, and it'll tell you why you were denied.
Okay.
I'm going to assume, just for this meeting right now, that you were denied because you didn't have a diagnosis. I'm just going to assume that.
Okay.
So a claim needs 3 things. You need an in-service event, which means evidence from service.
Mm-hmm.
You need a current diagnosis, which you now have in 22.
Mm-hmm.
And then you need a Nexus, which is just linking the current diagnosis to your military service.
Okay.
So we have the diagnosis. That's there.
Okay.
On that note, just in plain language, in your own terms, or in your own way of explaining things,
Mm-hmm.
how does your mental health relate to your military service?
So, that's a tough question. Well, I'll start with probably why I don't have any service diagnosis. In the job that I was in administration, so ran the limited duty office and saw exactly how folks reacted to anyone who, went and sought mental health for any reason,
Yeah.
and what happens to your career after that. So seeing that obviously was a reason why I never got seen for anything. That said, the last 2 years I was seeing the what's called the Marine Family Life Counselor, so the MFLAC, which basically is the only way that you can have any sort of counseling that's not recorded, which is what I felt like I had to do with them during that time frame. I'd say the vast majority of the reasons that I had an onset of anxiety and depression were probably based on a difference in what I expected the military to look like while I was in and what it actually turned out to be. Conflict in, the things that we had to do, the way that we, were treated and treated people, developed a massive amount of guilt, which I think in turn, caused a lot of the anxiety and depression. If that makes any sense at all.
It does. It does. It does. So, at first, I'll tell you my thought roller coaster. Okay. Whenever you say, because I'm looking at it strictly from a service connected benefit perspective. So when you said you had 0 evidence from service, that sucks. I'm
Yeah.
just gonna be real with you. That's a
Yeah.
downer. Okay. Now, you also said you spoke to Marine Family Life Counselor, and I understand. I was also in the Marine Corps. I understand that's not, behavioral health, and it's not put into your service treatment record.
Right.
Now, do you know if that is in your personnel records, or if there's a note saying you met with Family Life, or is it strictly your word?
Yeah, no, it's unlikely that it's in any sort of file. That was the reason why I went with them is so that it wasn't in my file, which obviously looking back is not ideal. But yeah.
That's okay. So that's still a downer, but you have something. Okay.
Mhm.
You have a testament of saying you went to go speak to Marine Family Life Counseling, and then
Mhm.
for the reasons that you described.
Mhm.
Now, I am going to recommend you write a statement, and I'll go ahead and link that form for you right now, actually.
Okay.
Um, just in plain language, exactly what you just told me
Okay.
of why you didn't go to behavioral health and why you chose to go to Marine Family Life Counseling.
Mhm.
More so on that, I want you to talk about what you spoke about um, during that counseling appointment. Okay.
Mhm.
So let me just get my notes down real quick.
Mhm.
Why you spoke to MFLAC and situations / symptoms discussed during counseling session. I'll just say that. Okay.
Mhm.
So that's not like the gold standard, just to be honest with you. Because you really want behavioral health records, that would make that a slam dunk.
Mhm.
But regardless, it's something. Okay,
Yeah.
it's definitely not something. I'm not too hopeful on it. We're probably gonna
Mhm.
have to fight it in appeals, just to be real with you.
Okay.
But with the statement of saying that you did go to MFLAC and now you have a current diagnosis
Mhm.
of all the disorders that we discussed,
Mhm.
that's good enough for a supplemental claim. Okay.
Okay.
So that's going to be a supplemental claim.
I will say too that the first time I was ever diagnosed with anxiety was with the VA. So it's in my paperwork there. It says, I think it says generalized anxiety.
Is that from the McLean report?
Yes, yeah.
Okay. All right.
So it's in there. It just said not approved. So
Okay. That's fine.
yeah.
So we have the diagnosis. I still want to see the decision letter for mental health specifically.
Okay.
But regardless, you have a diagnosis. You're going to submit a statement talking about the MFLAC that
Okay.
warrants at a minimum a supplemental appeal.
Okay.
Now, I'm not extremely hopeful on that claim.
Yeah.
So we're definitely going to want to revisit that if it's denied. I hope it's not, but if it is, um, just prepare yourself for that. Okay.
Yeah. Okay.
Now let's get back to increases. So
Mhm.
increases, you said your neck has gotten worse. Can you
Mhm.
describe like how has it gotten worse?
Yeah. So it was only, I'd say, a few months after actually getting out. Obviously, being a Marine, you know how many pull-ups we do. So I was go at the gym and just doing the average amount of pull-ups that you do, and I don't know, something popped, and I ended up going to the ER that day, and it's really never recovered since then. I've done I've been to the chiropractor, I've done physical therapy, and nothing's really improved it all that much. When I was when it initially happened, they continued to call it um, muscle spasms.
Yeah.
That said, I never had an X-ray or MRI or anything to prove otherwise. Um, not for lack of asking, but so basically, um, ever since TBS, to be honest, so it was like right at the start, is where I got injured. Ever since then, had pretty severe upper back and neck pain. Um, and it's pretty stagnant, like it stays all day, every day, all night, every
Mhm.
night. And it's like a dull pain. Sometimes it gets sharp, sometimes it's just aching. But turning my head in either directions is and up and down has always been painful ever since then. Um,
Okay. That
so
last part is key there. So
mhm.
all the evidence you mentioned from service is great, but you're already service connected. So
Yeah.
that's the easy part, right?
Mhm.
Now that you're already service connected, we're looking at current symptoms. And so the last part of you saying, you mentioned turning your head left and right and then up and down. That's what we call range of motion.
Okay.
So it'll look something like this, right? The
Mhm.
VA will measure up, down, left, right, and then side to side.
Mhm.
And so um, we're definitely going to put in an increase for that. I'm going to assume your range of motion has decreased based off what you said.
Mhm.
And just keep in mind, you're going to have another range of motion test. Now,
Mhm.
um, with that, you need to understand what that actually means. So, for instance, if I did a range of motion test on my wrist, okay,
Mhm.
I broke my left wrist years ago. I can bend it down, and right here is where it hurts.
Mhm.
I can go further, but it really starts hurting. So
Yep.
once I feel pain, I'm going to express that to the examiner. I'm say, hey, that really hurts. I can probably go a little bit further, but I'm telling you, it hurts right now. And
Mhm.
if you don't say that, the examiner doesn't know.
Okay.
Right? So you have to express your symptoms to the examiner while you're doing your range of motion test for your neck.
Mm-hmm.
Just be transparent with them. Okay.
Mm-hmm.
We're definitely going to do an increase on your neck. That one's pretty easy. Ankle conditions and knees are generally 0 or 10% anyways.
Okay.
Is there anything crazy going on with your left ankle?
No, so that one was definitely this like service incidents. That was OCS.
Okay.
I mean, other than similar to neck being range of motion, yeah, I mean, it just kind of pops once in a while. But I don't know if that's just because I'm 30.
What is your range of motion like for your ankle? Like, are
um,
are you able to put your shoes on without your hands or anything like that? Like, could you like slip your foot into your shoe?
yeah, I can. I can. It's more of like when I'm on consistent, like walking or running for a long
Mhm.
time. That's when it is exacerbated more than anything. So it's more of impact related than.
Yeah, yeah. So yeah, pain with motion, 10%. So we're not going to touch that one.
Okay.
We'll talk about the knees. The knees could be a bit complicated, but they're
Okay.
generally 0 or 10% as well.
Okay.
What does your range of motion on your knees look like right now?
Um, I'm not really sure what it's supposed to look like because it's been so long since I've had halfway decent knees. But the main issue that I have with my knees is if I go into a squat position or anything like that for more than 10, 15 seconds, I lose all like blood flow to my legs and my feet. So when I stand up, it all rushes down to my feet because there was it like
Yep.
stops the blood flow, if that makes sense.
Does your below the knee and your feet go numb or tingle or feel like 1,000 needles sometimes?
Yeah.
Okay. We are going to claim. I don't know if it would be sciatic nerve. It's not sciatic nerve damage. We're going to claim nerve damage below the knee. Do you feel that? Do you feel that numbing sensation or falling asleep sensation above the knee too?
No, not usually. Not from what I'm remembering.
All right. There's probably some pinched nerves going on in there.
Okay.
Now, with that, we're going to talk about healthcare after this. Okay.
Okay.
Let's kind of make that right now. There. Okay. Now that was your nerves for your knee, range of motion, pain. Are you able to do you need a brace or a cane or anything like that for your knees?
I've worn braces before. I don't know if I necessarily say need. I would be reticent to say that mainly because I'm not a doctor.
Have you been prescribed a brace?
No.
Okay. Do you have any balance issues with your knees?
I'm not sure. But I
Okay.
haven't, yeah, I mean, unless it was tested, I'm not really sure.
All right. So first, speak with primary care about nerve damage below the knee. Primary care about instability of the knees. Girl. Okay. Based on what you said, I'm not going to recommend any increases on the knees,
Okay.
at least not yet. Now, once you speak to your primary care, and let's just hypothetically say you get x-rays and you do all this stuff, and there's something going on, and it decreases range of motion, or it increases your pain, or there's an instability, or you're prescribed a brace, right? Then we might revisit that. But based on what you have now, I wouldn't sweat it too much.
Okay.
And then TMJ is a weird one. Generally speaking, just hearing you talk, I really wouldn't do an increase on TMJ. It's a jaw
Mm-hmm.
condition. Now, you do have access to dental care. You should keep that in mind.
Okay.
And side note, because we talked about VA healthcare, have you signed up with VA healthcare at all? What does your healthcare regimen look like?
Yeah, so I did when I was in Virginia, and I went to psychiatrist, psychologist. But then outside of that, I did do, PCP through my, regular civilian insurance.
Okay. So I'm glad you said that. Any evidence you have of anything that we're going to put in recommendations from your private providers, you have to upload with your claim. Okay.
Okay.
We'll talk about what that looks like at the end.
Okay.
But if you don't give the VA access to those records, the VA doesn't have access. Okay.
Okay.
Now that was increases. We talked about your denials. I absolutely have to see the decision letter for the back and constant pain because I'm assuming it's mid and lower because you're already connected for your cervical, your
Okay.
neck area.
Mm-hmm.
But we'll just kind of tabletop that one. Now, in the event you do have a lower back injury and you're able to get diagnosed, that might change some things.
Okay.
So be sure to find that decision letter and send it over.
Okay.
Increases, denials. Let's talk about secondaries. So going off of your cervical strain, do you have any sort of nerve damage in your arms, your elbows, your hands? Do your hands go numb, kind of like your below the knee and your feet do?
Yeah, actually, so that's been one of the main issues that I've had. So anytime that my hands or arms are like back or go above my head in any way, I lose almost all feeling in my arms and hands. At the same time, why if I'm back like that in any way, like I guess that would be range of motion. I have like muscle twitches. They kind of go sporadically and freak out. It's really weird. And that's gotten consistently worse as time progresses.
Oh yeah. So radiculopathy is just a pinched nerve
Okay.
up in your cervical area. There's a system back there.
Mm-hmm.
There's probably something pinching a nerve, which is what's causing your arms, elbows, hands, fingers to kind of go numb.
Mm-hmm.
Super easy claim, especially if you have X-ray evidence showing that.
Okay.
Super easy. We're definitely going to claim those. Left ankle at 10%. I really wouldn't recommend any secondaries. Same with the knees, unless your knees are more severe. Because it sounds like you're still squatting and going to the gym and doing all that stuff. That's fine. Now I did make a mistake. Nerve damage below the knee. That's going to be secondary, actually.
Okay.
Secondary to knees. Okay.
Mm-hmm.
Left ankle, left knee, right knee, TMJ. Okay. Do you have migraines at all?
I'm not sure if I'd classify them as migraines.
Are they like mild headaches?
Yeah. And again, I'm not really sure what's causing it. But yeah, sporadically, once in a while, it's not consistent. So.
Okay. The reason why I ask is because if I had neck pain, okay, especially that had pinched nerves going on,
yeah,
and I'm constantly, I can't look left, I hurt, whatever's going on, and I have a jaw condition, you could see how that could cause a migraine, right? Now, it doesn't sound like you have migraines. It sounds like you have like some mild headaches, but regardless, I think we should submit the claim. Now, we are going to want evidence, okay? And so you want to speak with your primary care about migraines and headaches caused from your cervical and TMJ.
Okay.
That makes sense?
Yes. Yeah.
Okay. Secondary to cervical. Now, if you submit this claim as is right now, it's extremely weak. Okay. You have to have evidence showing cause that your neck condition is causing your headaches. I put migraines, they're same for VA rating purposes. So make sure you get that evidence. A diagnosis would be great for migraines. A treatment plan would be awesome.
Okay.
And then once you start that regimen, I would keep a log of your migraines and headaches, your symptoms, what that looks like. If you do, let's say you get diagnosed and you're given sumatriptan, which is a medication for migraines, let's say it's a 100 milligram tab. Every time I took one, I would just say migraine, started at 2, ended at 6. I took a 100 milligram sumatriptan, right?
Okay. Got it.
Doing that, it shows, one, you have migraines. It shows the severity because it required a medicated treatment. And then 3, it shows the frequency. So for instance, if your prescription has 10 pills and you go through all 10 pills in 3 months, that's about 3 migraines per month, right? So it shows frequency too.
Gotcha.
That's assuming that you can get diagnosed. If you talk about this and your PCP makes a determination that you don't have migraines, scratch everything I just said.
Gotcha.
Okay. Migraines, secondaries. The last thing I'm going to talk about is you are PACT Act. Okay. You don't have to know what that means. I'll go over it. And so there's 5 common conditions of PACT Act that we see, especially in our generation of veterans.
Okay.
Let me make sure Jordan is on the list real quick. Conditions. Yes, Jordan's on the list. Okay. So you've been to Jordan, and the most common conditions are sinusitis, bronchitis, rhinitis, asthma, and then IBS. So out of those, do you experience, let's just call it a stuffy nose for right now, or have you taken antibiotics for any sinus issues? Are you on a inhaler for asthma? Do you have IBS? What does that look like?
I believe I certainly have IBS. I don't have a diagnosis for it, but that is definitely something I have been looking into in the last couple of years as to what's been going on there. And then by way of sinuses of the last 2 years, I think I've had like 3-4 sinus infections, which is weird. So.
Okay. You need to, or I'm going to recommend you speak with your primary care. Now, there's a reason I keep saying speak with primary care in all of these, because it's critical, okay?
Yeah.
I'm just trying to reinforce that theme there.
Got it.
So speak with primary care about sinusitis, and then speak with primary care about rhinitis. Rhinitis is like allergies, okay, would be a very mild form of rhinitis. It really goes into polyps in your sinuses.
Okay.
And then obviously sinusitis is kind of the same thing. Don't worry about the differences between the two. But if you're diagnosed and given a treatment plan, absolutely submit every single one of these. Now, IBS is difficult to get a diagnosis for because it requires a colonoscopy and all this stuff. So for this one specifically, if you are given a treatment plan, so that would look something like you talk to your primary care and you tell them about your IBS symptoms, and they would prescribe you some medication, right? That documented symptoms and the treatment plan would be enough to submit the claim.
Okay.
So it doesn't have to be a formal diagnosis, but you need something in there where a medical professional can see it and say, you know what, let's just call it IBS for VA rating purposes.
Okay.
What you don't want to happen is submit any of these without any evidence at all, because then you're just going to get denied and we're back at square one. What about asthma? Do you have any breathing issues?
I don't think so. Not that I've experienced recently.
Okay. So. If that ever changes, same thing applies. Speak with your primary care, get the diagnosis, get some treatment, submit the claim.
Okay.
Some other Do you have any cancers?
No.
Okay. If that ever happens to you, there's a lot of cancers covered under a PACT Act. Super, extremely easy claim.
Mhm.
Now, I'll tell you this: I see a lot of veterans. Your case looks pretty simple to me. Okay. The only thing I'll kind of make red. I'm going to make red what I'm going to call a weak claim, and I'll make green what I'm going to call a strong claim. Okay.
Okay.
So your cervical issues. Just make all this bold. No, way too green. That'll do. Your cervical increase is going to be
Cool.
pretty solid. Okay. Now the nerve damage, I'm going to make yellow. That's also a bad cut color. Let's go with brown. There we go. I don't know about your knees. It's not
Okay.
too common to see nerve damage below the knee. Not saying you don't have it. But if you get an x-ray that shows your knee strain specifically is causing the nerve damage, then this becomes green. If you don't have that, probably not so much. Now, based on what you said for your nerve damage in your arm, super easy claim. An x-ray can say that.
Okay.
This one is absolutely weak. These three, if diagnosed, okay, are very, very strong claims.
Okay.
Now, your mental health one, there's no way I can say it's weak or strong without looking at the decision letter. Okay, so
Okay.
once you send that to me later on, we can definitely look at that. I skipped over hearing treatment. Can you talk to me about your hearing treatment from service?
So I'm actually not sure on that one. I don't actually have any hearing treatment that I'm aware of. So that might.
Okay,
I'm
yeah.
not sure what that is.
I was looking over what you sent me and was just like, think of all the times in the Marine Corps you had to go in the booth and push the button, right?
Yeah.
And so that came up as audiology treatment. Have you ever been
Oh,
told you have hearing loss at all?
not that I remember. I'd have to like read through and look at what's on there, but I don't. Outside of going there, whenever I've just been told that I needed to go and do that booth thing, I don't. Yeah, I don't really remember
Yeah.
anything specific. So.
Do you have tinnitus? Do you have ringing in your ears?
Once in a while, but I don't really know. I don't have like a diagnosis or anything for that.
Okay.
So.
The tinnitus is weird one. And looking at what your MOS was in the Marine Corps, it's not going to be a higher probability, just to be real with you.
Yeah.
But you do have a deployment to Jordan, and so talk to me about what that looked like. What did you do day to day? What environments were you exposed to for a long period of time?
Yeah, nothing that would really include hearing loss. I was on base pretty much the whole time. So.
Okay.
Yeah. Nothing
Were you like on a flight line at all, or?
No. Yeah, the only thing that was nearby was there was helos taken off nearby, but that was about it.
When we say nearby, how close are we talking about? Like 20 feet or like 200 meters?
It was like half mile away. It wasn't on our base though. Yeah.
Okay. We covered muscle spasms in the neck, physiotherapy, hemorrhoids. That is a claim we're going to submit. We're also going to make this black.
Okay.
Hemorrhoids. All right, that's about it.
Okay.
Looking at these, so basically, this recommended list is what you're going to submit. Okay. Are there any, before we get into what that looks like, are there any questions you have on any of this? Did we not cover something that you wanted to talk about? Anything at all?
I mean, the only question I would have is like, based on your experience, I mean, it sounds like not having any proof of go into behavioral health or anything, do they ever, or in your experience, have you ever seen anyone take into account the fact that if you do go get seen by behavioral health, that you'd essentially be kicked out? I mean, I know that it's a thing that's being talked about, but I'm curious by way of like what's been approved and stuff, like if that even is taken into account at all.
Yeah. So if I were you, okay, your argument wouldn't be, I didn't go to behavioral health because of X. It would be, I did go to a Marine family life counselor, 10 times, once per month, whatever that looked like for you. And here's what we spoke about.
Mm-hmm.
I would lead with that.
Okay.
And that's going to be hammered out in this statement that you're going to complete, right? Why you spoke to MFLAC, your situations, your symptoms. And then you can say, because of my, and just knowing the Marine Corps, it's probably, there was probably a command climate going on where you didn't want to go to behavioral health. I get that.
Right.
And so that would be, lead with the MFLAC saying, hey, I do have evidence. It's there. You're going to have to account for it in my personal statement.
Okay.
Now, the reason the statement matters, okay, and we're kind of like jumping ahead here, is because I bet money that's going to get denied, just to be straight with you.
Yeah.
Which means it's going to force you into another appeal. Where
Okay.
it's already been denied. We're doing a supplemental claim. But now we're going to get our evidence in a row. You have the diagnosis. You're going to have this statement from this Marine family life counselor. Depending on what happens after this claim, then, it might be worth it to fight it in a real appeal to the board. Maybe. It just depends on what the decision letter says. Now, all this is speculation because I haven't seen the decision letter for mental health, right? But assuming, I'm pretty sure there's no in-service event and there's no current diagnosis, so it was denied. Assuming that, you have the evidence to submit a supplemental claim, and this one is going to be, it's going to be difficult, okay?
Yeah.
And it depends on why you're denied, again, assuming that you are. Now, hey, let's say I'm wrong. You get a stellar C&P examiner. You get an awesome rater at the VA. They take into account your statement with Marine Family Life Counseling and your service connected, and then, I'll eat my words.
Mm-hmm.
That's probably not going to happen, but it could, right?
Yeah. No, it's good to know. Yeah.
And so keep that in your back pocket, just in the back of your mind. Just prepare yourself to fight this if it's worth it.
Okay.
Looking at you're at 43% right now, and I will share this screen. Okay, this is you right now. And so we have, I'm going to assume, let's assume your mental health is denied. Let's assume your neck increase is denied. It stays the same. Let's assume your nerve damage below the knee is denied. Let's go ahead and assume your nerve damage in your arms are approved. Okay. So left arm 10, right arm 10. That puts you at 56, which is 60 total.
Okay.
Migraine secondary to your neck, not a hopeful claim at all. It does. Looking at your hemorrhoids and your reaction when I asked you about IBS, you probably got something going on down there.
Okay.
That's rated at 10 or 30%. And so with that being said, I'll tell you the symptoms for 30%. Okay. Someone with 30% for IBS would have abdominal cramping, not from normal female abdominal cramps, if that makes any sense.
Yeah,
really weird for me to say.
No, you're good.
But cramping from constipation, and then there's a diarrhea, and that relationship, there's a relationship with that, right? So you'll be backed up for a few days, and then you'll do business way too many times, and then that cycle will kind of start over again. That's what IBS looks like at that 30%.
Okay.
So is that you?
100%, yes.
Right.
Yeah.
So let's just assume you get 30% for IBS. That puts you at 70.
Okay.
And sinusitis and rhinitis, those are generally 10% each. Okay.
Okay.
Now you can get a higher rating for both of those, but let's just lowball everything for
Mm-hmm.
planning factors.
Mm-hmm.
Hemorrhoids, that's probably going to come back at 0%.
Yeah.
And so you're looking at 80%, 75 really, and that was with a denial for your cervical increase. That was with 2 denials for your nerve damage below the knee. That was with a migraine denial, low ball sinusitis and rhinitis claim. And then we didn't even talk about mental health, right?
Mm-hmm.
Now, looking at the evidence that you sent me, we don't have to get into it. I do think if you're rated for mental health, it does look like it's going to be 50. Okay. That would put you at 90% with a pretty decent bilateral factor of 4.1. If that 50 was 70, that puts you at 93%. And so any of those other denials that we denied were
Mm-hmm.
approved, you could be at 100%. Okay.
Yeah.
Now, I do think your mental health is going to be at 50%, and I do think it's going to take a long time to get there through the appeal process.
Okay.
But I think you can get there.
Okay.
And so that's basically a really long way of me saying I think you could be 80, 90%,
Okay.
maybe 100. It really depends on your mental health symptoms during the exam.
Okay.
But yeah, do you have any questions at all on anything we went through?
No, I don't think so. This has been extremely helpful.
Awesome. Do you plan on submitting? Are you going to use a VSO? Are you going to use a representative? Are you doing this yourself? What does that look like?
I'm not really sure how the process works and who I need to talk to be completely honest.
Okay,
so.
that's fine. What state do you live in?
New Hampshire.
Okay, that's gross. I'm kidding. All right, so I don't know what the VSO culture looks like in New Hampshire,
Okay.
but you can find a VSO, VFW, DAV, American Legion, whoever. You can go to OGCVA. If you just Google OGCVA and put in your city and state, you can find a VSO that way. There's county VSOs as well. Any of those options would work. I always recommend using a VSO at a minimum. Now, you can file these yourself on va.gov, and I have some how-to tutorials on my channel that will walk you through step by step. But again, I always recommend a VSO.
Okay.
But it's ultimately your choice, okay, on whatever it is you want to do.
Mm-hmm.
And if you don't have any other questions, that's about it.
Okay. No, that's awesome. Thank you so much for your time. I've definitely, this has been very eye-opening, so I greatly appreciate it.
Awesome.